Welcome to the Deep Dive. We take complex information, boil it down, and help you get really informed really fast. Today, we're looking at something pretty unexpected, how cutting-edge video game technology is popping up in medicine.
It really is surprising. You hear Unreal Engine, you probably think, stunning graphics in the latest games. But what we're exploring today is how that same engine, that same power, is actually changing how surgeons train and plan. It's offering this incredible way to prepare before an operation.
Right, so our focus today is understanding how these virtual worlds become sophisticated practice areas for surgeons. How can they test their skills, rehearse really complicated procedures, all in a totally safe virtual setting? We're talking game tech saving lives, essentially.
Exactly. It's bridging that gap.
Okay, so let's really get into this. Surgery needs incredible precision, right? Tiny movements, complex anatomy. It feels almost impossible to recreate that digitally. How does something like Unreal Engine, known for building huge game worlds, even start to model the fine details needed inside a body? Is there a trick to it?
Well, it's less a trick and more about incredible flexibility in how it puts things together virtually. Think about trying to digitally create, say, winding medical tubing, or even the tiny paths of blood vessels or nerves. They aren't straight lines, obviously. They bend, curve, split. The engine uses this technique. It's sort of like using really smart digital building blocks. Instead of shaping every single curve by hand, creators can basically stamp virtual pieces along a flexible path they draw out.
Oh, okay. So you draw the path, and the system just fills it in with the detailed shape, like a tube or a vessel.
Precisely. And it makes it easy to build and adjust these really detailed, realistic shapes. They fit perfectly into whatever virtual scene you're building, which is crucial, It means the virtual surgical area, the surgical bed, as you might call it, can be perfectly set up for different operations.
So whether it's a large organ or tiny structures, the environment is spot on.
Right. It makes the virtual setup accurate, letting the surgeon just focus on the actual procedure.
Okay, that makes sense for the environment, the stage. But then there's the patient. We've all seen those incredibly lifelike digital people from Unreal Engine, the metahumans, right? Games, movies.
Yeah.
They look unbelievably real. But looking real is one thing. How do you make that digital skin or a virtual organ actually feel or react like real tissue when a surgeon interacts with it? That seems like a huge leap.
Yeah. That's the critical next step. And it involves giving these digital surfaces what we call dynamic properties.
Mm-hmm.
So imagine it's not just a static picture of tissue. It's tissue where the way light hits it, the color, the texture, it can all change instantly in real time.
Okay. Dynamic properties. How does that help in a surgical context?
Well, it means the virtual tissue doesn't just look real. Its properties can actually change to mimic different types of tissue. Think about it. A surgeon needs to tell the difference between muscle, fat, maybe diseased tissue, versus healthy tissue. This tech lets the virtual tissue show those differences visually and maybe even texturally to some extent in the simulation. It can even show how tissue responds during an operation, giving that immediate feedback a surgeon relies on. It's not just a picture, it's like an interactive map of that specific anatomy.
Okay, so we've got the detailed environment. We have these hyper-real digital patients with tissues that visually respond and look different. But here's the part that really fascinates me. How do the virtual tools, the scalpel, the clamps, actually interact with this virtual tissue? And maybe more importantly, how does the tissue react? Because surgeons rely so much on the feel, the feedback. How do you simulate that?
Right, this is the absolute core of it. And it relies heavily on the engine's really advanced physics capabilities. These aren't just for making game explosions look realistic. They're adapted so that virtual surgical tools behave realistically when they touch those dynamic virtual tissues.
Can you give an example? Like what happens when you use a virtual scalpel?
Okay, yeah. So with a virtual scalpel, the tissue doesn't just, change color or get a line drawn on it. It actually deforms realistically. It separates, it cuts in a way that mimics how real biological tissue would respond. You see the clean incision, maybe even the slight resistance or tearing you'd expect.
And what about, say, grabbing something, like with forceps or a clamp?
Same idea. If a virtual clamp grabs or pulls tissue, that tissue will stretch, it'll compress, it responds naturally to the force being applied. It's not stiff or fake.
Yeah.
It has that given resistance.
So the key thing is the response of the tissue. It's not just showing the action.
Exactly. That realistic response is critical. It's not static, it's a dynamic simulation. The virtual anatomy reacts to every touch, every cut, every movement, ideally just like it would in real life. The goal is to perfectly copy how human anatomy behaves when surgeons work on it.
So if you push too hard, it might tear incorrectly.
Potentially, yes. Or if you make a rough cut, you'll see the result. It helps build that muscle memory, that understanding of the physics involved, even if the primary feedback right now is visual.
That's incredible. It's building that spatial physical understanding. And I assume all this complex interaction has to happen instantly. No delay.
Absolutely. Zero lag is essential. That's a big reason Unreal Engine is so useful here. All these complex interactions, the deforming, cutting, stretching, they're handled smoothly and super quickly by the system. So the simulation stays fluid, very responsive, totally immersive. And that responsiveness is vital for training, right? Every fraction of a second matters in surgery.
Okay, so let's pull this all together. For the surgeon listening, or for a medical team, what does this actually mean in practice? What are the real benefits here?
Oh, the benefits are huge, really transformative. First off, it's about performance testing and just sheer practice. Surgeons can try out techniques, practice scenarios over and over, completely safely. Imagine unlimited chances to perfect a tricky maneuver with zero risk. You could run a procedure 100 times if you needed to.
That alone is massive, especially for rare or super specialized procedures.
Exactly. Which leads to the second big plus, preparing meticulously for complex operations. The system lets you rehearse really unique or difficult surgeries. Think complex orthopedic stuff or delicate brain surgery, maybe navigating around a clot. Surgeons get invaluable practice before the real thing. That boosts confidence and hopefully leads to much better outcomes for patients.
And what about trying out new things? New tools, new approaches? Testing those live seems risky.
Right. So the third point is evaluating new tools and methods, new instruments, innovative techniques. You can test them thoroughly in the virtual world first, before they ever see a real operating room. It cuts down the risk massively, allows for faster improvement of new ideas, and just leads to safer adoption of new tech. The core idea behind all the simulation is pretty simple, really. It lets medical professionals fail safely. You can make mistakes, you learn from them, you experiment, you try stuff out where it isn't dangerous or, frankly, incredibly expensive. It's about building mastery without the real-world stakes.
It's really something to think the tech behind video games is creating these detailed surgical environments, using those flexible shapes you mentioned, making lifelike digital tissues and then simulating how instruments interact with them, how they respond dynamically. It's an incredibly powerful, safe platform for doctors.
It really is. The potential for skill development, for patient safety, it's immense.
So where does this go next?
Well, think about this. Imagine a future where every complex surgery is practiced first on a personalized virtual copy of the actual patient made from their own scans. Just think how that level of precision, that tailored preparation could transform surgical outcomes, transform medical education all over the world, making top-tier care safer and maybe even more accessible. It's quite a future to consider.